Hi, my name is Callie. I'm going to be presenting on Joel Ringdahl today. So just a brief introduction. He has a PhD and he is a BCBA. He is the editor of the journal Behavior Analysis, Research and Practice and is an associate professor at the University of Georgia in the Center for Autism and Behavioral Education Research. So just a brief bit about his educational background. So in 1992, he got his bachelor's in psychology from the University of Florida. Then in 1995, he got a master's degree in psychology from Louisiana State University. In 1999, he got his PhD from Louisiana State University as well. And then in the present, he is an associate professor at the University of Georgia. So I'm going to just kind of briefly talk about each of the articles I read when doing research, and just try and get an overall view of his focus for his most of his research. So the first is resurgence, the unintended maintenance of problem behavior. This article defines resurgence when a behavior is extinguished and then ends up coming back. It also talks about the contributing factors that actually lead to resurgence and kind of what conditions for those are. The effects of different adults as therapists during functional analysis. So in this one, he took participants that had severe behavior problems, kind of such as SIB and aggression. And in this one, in 5 to 10 minute sessions, a caregiver would be delivering the consequences, coached by staff, and then a separate session, staff would deliver the consequences without caretakers present. And what he saw was that problem behaviors increased in the presence of caregivers versus independent staff, inpatient staff. Adults can be discriminant stimulus in the therapy environment. So that's kind of the takeaway from that one. The next is the effects of response preference on resistance to change. So in this article, he looked at different variables that practitioners should consider when doing functional communication training and focusing specifically on manding. So he looked a lot at the preferences for mands and how they're used. And how to maintain behaviors using preferred mands during functional communication training. So this is further demonstrations of individual preference among manned modalities during functional communication training. So in this particular article, there were 18 participants with developmental disabilities, and at some point during the study, each participant had a preferred response modality, whether it was like vocalizations or with a communication device or signing. So when developing functional communication training programs, he concluded that you should consider the proficiency, the effort and the preference of the individual to increase effectiveness. Then we have further evaluation of idiosyncratic function for severe problem behaviors, aggression maintained by access to walks. So in this case study, done with an 18-year-old girl, they did an initial functional analysis that was inconclusive. So they were unable to identify what the function of the aggressive behavior was. They used a preferred activity when not in session, and this actually turned out to be walks. They used them as contingent and non-contingent reinforcement, and using that reinforcement, they were able to decrease the aggressive behavior to almost zero across several sessions. So for the interview questions, one, I would ask, how has being a professor impacted you as a practitioner? Just being so close with the theories and the research behind it. How does that translate into practice? And then, are these interventions successful in everyday practice? And what are kind of some of the issues that you can run into with fidelity? How close to perfect does the fidelity of suggested interventions have to be to kind of see some of the same results? In reference to resurgence, does not picking up on certain behaviors severely affect resurgence? And then what advice would you give to new BCBAs that are just starting out, especially when dealing with severe behavioral problems and learning about behavioral analysis? So the importance of Dr. Ringdahl's work, first and foremost, in my eyes, he works in academia and is educating future behavior analysts and people in the field of ABA. So just being a strong voice in that aspect, being a student myself, is very important. Then helping to appropriately target severe behaviors, creating treatment plans that are scientifically sound, and studying factors in the maintenance of these treatments is really important, especially because the more severe the behaviors, the more challenging it is, and just having that level of research for those is really important. And then also, he is an editor for he has been the editor for several journals, and it's really important that he's leaving his own mark on the field of ABA and is involved with peer-reviewed research. That is